After conducting the CRO on this athlete, I'm not generally seeing any areas of concern I have about the rehab process. I use the RadMat for this athlete, and as far as the results from it that I'm seeing, the biggest outliers or the biggest concerns would be the him arriving at time for the rehab, his positive attitude towards the rehab process, and the ability to stay focused during the rehab. With it being so late in his rehab, he's kind of starting to wane more towards wanting to get back to return to play, which is a good thing. But I mean, still, he must still do his rehabs to ensure that the process goes as efficiently as possible for his return to play. For this patient, the PRO I found was only PRO I could find was called the EARS, which is the Exercise Adherence Rating Scale, which basically asks questions on are they doing the recommended exercise provided by the healthcare provider? Do they do the exercises properly? Are they asking questions about the exercise? Do they know what they're doing during the exercises? And so on and so forth. And the only area of concern I've seen with this is sometimes when he's tired, he doesn't actually come in for his rehab. And that's obviously not good. After looking at both this PRO and CRO, this patient, I believe, is not at much of a risk for exercise adherence and coming in for rehab sessions. Just based on the results, there's only maybe one or two areas where they were seen as being out of the ordinary or areas of that would require more attention. Personally, I think this PRO would be nice with another patient. It just didn't work too well with him because he's been decently good about most of his rehab exercises, with the exception of a few hiccups here and there. But that's, I guess, normal in some aspects of being a young college athlete and being so close to return to play. Uh, with doing functional exercises at this point, there's not much. They're more into the actual functional rehab versus the exercises we still have them doing just for strengthening purposes. I believe this PRO could be good for another patient, possibly if they believe that they're doing as much as they can during the rehab, and I believe otherwise. I could give them this and kind of like bring to their attention that, hey, I'm actually not doing as much as I thought I was in my efforts of doing my rehab, and I need to be a more active part of my own recovery. As far as the intervention for this athlete, I think at this point the best thing I could possibly do for them is give them positive self-talk to kind of reinforce their findings based on another CRO they recently had implemented onto them, the Dorsey test, which gave them a decently positive outlook on the progression of their injury. So, like I said, the best thing I could see for this athlete would be implementing a positive self-talk, reinforcing the ideas that they are strong enough now, they are progressing in their rehab, they are getting close to full functional return to play, and just kind of giving them the mental confidence that they might or might not need to uh, play at the level that they were at previously before the injury. Giving them short messages like being more confident in your legs, understanding that your legs will support you and can support you now that you've done all that you can do to give them the strength back post-op. This has been my discussion on my reflection of the CRO and PRO.